going on, guys? Just wait for some of you to pop in here, huh? That's what we'll do. We are live. It's an unusual time to start a live stream. Yeah, if you guys have questions, just type them in the if you have questions, type them in the box there in the chat, and then I can answer your questions. Yeah, that's right, Saad. What's going on, Saad? What's up, Asma? Mr. Amateur, Mr. Amateuroso 96. I feel like I remember your name. I was saying how it's an unusual time to start a live stream because it's, it's almost 4 p.m. here in Japan, and in the United States, that would be 3 a.m. on the East Coast. So like most of you guys are asleep. Anna Pang, Mohammed. Guys, if you have questions, because I'm only going to do a half an hour. So if you have questions, just ask them in the box there. You know, if I do this live stream at night, my time, and it's afternoon in the US, a lot of you guys will be here. Hi, Doc. Diaz, Shami, Moyad, Muayd. Shireen asks, I don't know if you're able to answer this, but I'm from UQ. I went to UQ in Australia, and I have to take the CBSE November. Did you take it too? Nah. Well, I wasn't part of Oshner. I didn't have to do that. I was in like the 4-year Australian program. But if you're doing the CBSE, it's the same as the Caribbean students and some European students who do the CBSE. So you prep for that as you prep for the step 1. You can open a separate tab and type in YouTube, type in Mehlman CBSE comp, and I've made like 3 clips, maybe more, probably like 5 clips on just like how to pass CBSE. Okay, so you can just check that out. But it's like prepping for the step 1. Nasser, what's going on? Nasser, are you the one I tutor, or are you just another Nasser? Zachariah, what's going on, Zachariah? I do remember your name. It's like atypical. How many Zacharias? Kashif, what's going on? Insider Health, thanks. Zuba, what's going on? Javik here, what's going on? Hello, tomorrow. Azim, guys, you can ask questions. Yep, let's see. Chat box just moved on me. Mustafa asks, what is the topic of the live? It's just Q&A. Just if you have questions, just ask them. I'm only going to do this short time right now. Okay, so Kashif asks, what's the best time to do your high yield notes, the PDFs for step 1? You're going to do those at the same time as you're doing Qbank. Okay, I've talked about this. So the worst thing you can do is start the PDFs late, like when you're doing the NBMEs. Like this notion that they'll artificially inflate your scores in the NBMEs is laughable. What's laughable about that is because if you're studying the right resources, they're supposed to increase your scores. It's not artificial inflation. If you wait till the end game when you're doing like NBMEs at the end, you're not going to have time to do the PDFs. And so you want to do those alongside Qbank. Okay, like, you know, we're post FA era now. So think of it as like, instead of FA, you're just reading the PDFs because they're more efficient time-wise, consolidated around the NBME exams. You're going to do those. I've made clips talking about this, but you're going to do subject-specific PDF and YouTube playlist simultaneous to random mode in question banks. Okay, so you do Amboss or UWorld untimed tutor random, 4 to 8 blocks per day. Okay, 10 questions, so 40, 80 questions per day, random. Okay, untimed tutor random. But at the same time, you're going to do subject-specific PDF with YouTube MCQs. Okay, George, Matthew, how many CMS forms should we do? There's like 45, 50 forms. There's around 50 forms. And I want you to do the offline ones also. Should we consider them as assessment tools or learning tools? Definitely learning tools. You got the NBME 6 through 14 that you'll use for assessment and free 120, but CMS should be used for learning 100%. So it's a long discussion. Okay. I mean, I made clips on this stuff, but for step 2, after you do question banks, then you're going to do the CMS forms, all of them. Okay. If you're post-grad, you're going to do the question bank, all of it, then the CMS forms, NBME 6 through 8, double pass of all the CMS forms, free 129 through 14. If you're on rotations, you're obviously going to do things subject specific. Okay. And that's like pediatrics rotation. You do PEDS, UWorld, or AMBOSS questions, then the CMS forms. Okay. And of course, you'll be doing my PDF and my YouTube MCQs for pediatrics while you're doing UWorld or AMBOSS. EDM, UWorld plus your PDF equals a pass 100%, right? I mean, the politically correct answer is like everyone's going to be different, and that, yeah, it's sufficient, but you should be doing the NBMEs as well. Okay. That's UWorld plus my PDFs, YouTube MCQs, and NBMEs. Yeah, that's, 100% pass. The non-politically correct answer is you get a lot of people who aren't good test takers and they're not going to pass. Shami Khan asks, Mehlman high yield and UWorld enough to pass? I mean, the same question. Abdel, you passed last week. Good job. Anna Pang, how can I prepare step 1 after passing the CBSE exam? That's a lengthy discussion because I'd have to sit down with you regarding how much Qbank you've finished, how many of the NBMEs you finished. If you've passed CBSE Comp, you're ready to sit step 1. Okay, you're good to go if you've passed the CBSE. So you could sit in like 2 weeks, but it's not cookie cutter, because if you just passed, and the school's at different thresholds, you need a 65% to pass step 1 internal mark, approximately. So if your school requires a 63%, I wouldn't have you sit right away, the step 1. But if your school requires 68 or 70, I mean, where fewer of you guys pass the CBSE in-house, then, you actually are ruled in, more specific for passing step 1. You could sit like right away. So I'd look at your scores. How close are you to the 65 pass mark? But you'd be reviewing the NBMEs after you take the CBSE. So you finish the CBSE and you got to really consolidate around those NBME exams prior to sitting the step 1. Usam, what's going on? Rama, does doing the IFOM 1 exam help prepare for? Yeah, it does. I just lost where I was in the chat. Someone donated and it like brought me down to your 2.49 euro donation. Thanks, Nick. Is it too big of an issue? I'll read your question because you donated, so I'll just read it. Is it too big of an issue if I do subject specific for Qbank? I don't recommend it. It's not like, but your question is it too big of an issue? And the answer is not too big of an issue. I'm not fussed. There's a time and place. Like if I am sitting down with a student, they're like, oh, but I really want to do like subject. I'm just like, relax. It's fine. Okay. Like, but when I speak in generalizations for most students, like I prefer subject specific for going through question bank. That's what I prefer for macro retention. Because if you do all the cardio questions now and you feel like you packed the punch, well, in 3 weeks, aren't you going to like forget it? In a month, you're going to forget it. So I think interspersed, like sporadic coverage of the material in random mode is better for macro retention. That's my view. And I'm not like fussed, I'm not fussed. Like you'll pass. Let's see. I'm going to scroll back up to where I think I was. Wow, there were a lot of comments, huh? Costas, thank you. Asim, what if I feel like I remember answers in UWorld CK, but at the same time I have gaps? Should I switch to another Qbank? Yeah, I mean, I've said you can do AMBOSS. It's non-superior to UWorld. Both will increase your scores the same amount. They both have drawbacks. You can do either Qbank. It doesn't matter. If you finished a Qbank, you can either do the incorrects in that Qbank or switch to the other Qbank. Like you can do either or. It's not an issue. If someone's like spacing out really bad doing one Qbank and they don't care about money, just switch to the other Qbank. I think AMBOSS is better, truthfully, because you've got the explanations are more consolidated. They tend to give you explanations for each answer choice, where you click on the answer choice and it opens up a small paragraph for each answer choice as to why you got it wrong. UWorld's like a big essay with everything incorporated. Someone donated, so I'm going to scroll down. Anna Ping, you donated, but you didn't ask a question, Anna Ping. You could have thrown a question there. I'd see it. Thank you, Anna Ping. Let me scroll back up. Okay. Zuba, best way to study using World. I said 48 questions per day. Untimed tutor, random blocks of 10. So 48 blocks of 10 per day. Mohammed, is it normal to not remember a lot of previous systems near the end of your first read? I mean, it's normal to not remember things in general. Like, people freak out about like needing to remember everything. It's not how it works. Like, you're going to forget a lot, but the point is to stay consistent and keep doing questions in random mode every day. And but in terms of my PDFs, you know, you're going to do a subject specific approach with like the PDF and the YouTube MCQs at the same time as Qbank. But if you're doing random mode in Qbank, you're going to have those sporadic intervals of being retested on those high yield concepts, and that should help with your macro retention. Champion, just passed a step 1 Amboss, gave prediction 260 for step 1. How do I start step 2 CK for 270 plus? I have 1 year time. I love that. Because most people are just trying to pass, but I mean, yeah, it's for 2CK prep, open another tab, type in Mehlman 2CK. I literally put out a new video on that. I'm prepping for 2CK. Okay, like everything you need to do in like a 10-minute clip. All right, but you're just gonna have to do a shitload of questions. You're gonna have to do my PDFs. You're gonna have to do the YouTube MCQ playlist, and you'll do the CMS forms twice, and you'll do the NBME exams. Amir Ahmed, I'm having step 2 in 2 weeks, scoring 243 plus in NBMEs. What should I do to get that 255 plus? In 2 weeks, you should be on the NBME exams. I mean, you should make sure you finish 6 through 14 and free 120. You got to do all those exams, including the offline ones. You got to consolidate around them. If you got extra time, quote unquote, if you're like, well, I've already done, you know, most of them, I got like 12 through 14 remaining. If you're in a situation like that, I mean, you can do like CMS further consolidation as well. Like, you can redo the internal medicine forms or the surgery forms. You can look at my PDFs. You just say like, you know what, I'm just going to reread his Obsgyn repro PDF. Okay, like you can consolidate that way. But the point is, you're not going to be doing Qbank right now. You'd be doing NBME and CMS material. Utsov, which is the closest thing to the real deal, UWorld or NBMEs? NBMEs, I've harped on that. Maz 29197, which systems in your opinion are mostly asked in step 2? Everything. Okay, it's not like step 1. It's internal medicine, surgery, family medicine. Yes, all of them. But you got to know, I would say internal medicine and surgery are the 2 highest yield topics. That's where most of your points are. Karen, hey doc, how many weeks would you suggest to study for step 2? I would say 3 to 4 months. Okay. 12 to 16 weeks. That's what I would say. So 2 months for Qbank, 6 to 8 weeks for Qbank. And then I would say your CMS forms are going to be 3.5 weeks to do each pass of the 50 forms. So that's 7 weeks right there. Okay, so you got like 13, 15 weeks right there alone. Okay, and then you're gonna do the NBME exams. In 4 months, that's technically like, if you look at a calendar, it's like 18 weeks or something. Okay, so it's like, you know, 17, 18 weeks. So you know you can fit in that time. Hello tomorrow asked, my average in step 2 NBMEs 10 through 14 is 254. Do you think I can break 260 on the real deal? I do, but you know, your average is 254, and hence that's where you're most likely to score. But you just got to not make stupid mistakes. I'd review your biostats, make sure you don't fuck up any math calculations. Just sleep well. Ryan Blackney, your 3rd year medicine, taking step 1 in mid-rotation during 6-week break and 13 weeks, what to focus on before in 6 weeks. I mean, you got to, for step 1, you got to know pass level stuff is endocrine, high yield endocrine PDF, high yield path PDF, and Arrows PDF. Those 3 are the pass level ones. People get frenetic. People get like obsessed over like my high yield biochem, immuno, neuroanatomy, because obviously those are good PDFs and I pack the punch on those subjects where other resources are lacking. But the pass level subjects is like, you don't want to be trying to like pass step 1 and you're like looking at my neuroanatomy PDF, but meanwhile, like you don't know basic endocrine. Like the stuff that's going to get you to fail step 1 is like not knowing aldosterone high versus low or ADH high versus low, stuff like that. Nick, what's going on? Mutashim, Champion, Beth, how can we stop comparing ourselves to others during step prep? By just, I guess, walling yourself off from those people and not being around those people. That's what I would do. You gotta just like not talk to people, I guess. I mean, the gunner mentality back in the day when step 1 was numerical was to be like an internal autist. That was like the people who scored the highest were those who like didn't go to class, didn't socialize, and they would just like do questions all day in their room. And like, you're not going to be comparing yourself to others if you're just walling yourself up. The Fuji Wuji, you're in Poland. Where can I work if I pass USMLE? Well, isn't the whole point to work in the US if you pass USMLE? Igor Kudinov, why CMS seems so easy, but NBME is kind of hard? It's all in your head, the same questions. Amir Ahmed, I'm having step 2 and 2. You already asked that. I know you double posted because you wanted me to see it. Ariana Spatel, can I avoid FA in the last lap and switch to your PDFs? Yeah, I've said that for ages. Musawala, what is secure score of NBME to take exam? 65% plus on step 1 you need to pass. And if you get a 65 on your NBME, you pass by a question. So that's like, I like a buffer of 68% plus. That's what I want to see. Saad, current third-year U.S. med student for each rotation during doing UWorld shelf exams. Is that shelf honking? You need to do AMBOSS as well. No, you're going to choose one Qbank. You're just going to do one Qbank, UWorld or AMBOSS. You don't need to do Anki either. Krishna, I keep forgetting stuff. How do I retain the information? By just reading. I don't want you annotating. I don't want you taking notes. I want you just read the explanations. Treat Qbank explanations like you're doing Wikipedia. If you're looking at Wikipedia, what would you do? You're not going to take notes. You're not going to annotate. You're not going to make Anki. You're just going to breeze through, try to glean the main idea from what you're reading. Don't skip, but I don't want you obsessing over the explanations from Qbank. Zachariah, hey doctor, about CMS forms, do you recommend going through them as a Qbank or an NBME? You're just going to go 2 per day for the CMS forms. And if you're busy on rotations, you can do 1 per day. If you do 2 per day, it'll take you 3.5 weeks. Should you screenshot the incorrects in Anki? No. I've made prior clips talking about how you can do that for step 1 for NBMEs. No, you don't have to do that. You said or not because I'm second. No, you don't have to screenshot those incorrects. Palama Allen, what are some test taking skills for step 2? For long question stems, you want to look at the answer choices first, look at the last couple lines, glance at the lab values. You want to go backwards through large questions. That's an important test taking skill for step 2, because step 2 has a lot of long stems. And the worst thing you can do is start a question where you just start reading from the first line without even looking at the rest of the question. That's a bad test taking practice. Alice Tonitsky, step 1 student 63% on free 120. Is that a pass? It is not. You need 65% to pass. But do the other NBME exams. See how you go on those. Reem, is 3 months enough to pass the exam step 1 from the beginning? Not for most people. I mean, it depends on your background, right? But I mean, it's going to take you like 2 months for Qbank, a month to do the NBME. So in theory, if you've already finished second year medicine, like you could do that for 3 months. But, a lot of people, 3 months, they still struggle. Azim, what should I do to get 260 plus in step 2 CK in addition to UWorld CMS forms in your notes? I've said Qbank, CMS forms twice, my PDFs, my YouTube MCQs. As I said, open another tab on YouTube. Mehlman 2CK, I put out a clip like 2 weeks ago. MA asks, if someone doesn't know anything at all, starting from zero in farm, micro, I believe he needs to build a general good base. Why do you disagree? What are you talking about? That's like a very odd question. What do you mean, why do I disagree? Disagree with what? Igor Kudinov. I got 3 weeks left for CK exam. My last NBME was 232. Please give me advice for optimal preparation. You got 3 weeks left. I mean, you got to do 6 through 14 and free 120. And if your scores aren't going up, if you do, let's say, through NBME 11, you got 12 through 14 remaining, your scores are still like 232 and you're not happy, right? Because you want your 250 plus. Then I would take a step back, not touch 12 through 14, and I would do Qbank incorrects for like a month. Or I'd switch, I'd start a new, like let's say you finish UWorld, I do all your UWorld incorrects for a month. Or I do Amboss for a month. High volume, that's what I would do, like 80 per day. And of course, my PDFs, you do MSQs. But you take a month, and then you go back to 12 through 14 and see how you do. Actually, before you would go back to 12 through 14, I'd have you do 6 through 11 again, as though you've never done them. We wouldn't care about your scores because clearly you've sat them, but I would still have you do 12 through 14 after that. And then you'd be like, oh shit, my scores are higher now. It's like, well, there you go. Palema, what was harder for you, or which one did you enjoy more, step 1 or step 2? I preferred step 1. It was like I was sort of heterodox that way. I'd say 90% of people preferred. I know the pressure preferred step 2. I know the pressure is on 2CK now, where that's a stressor, right? Everyone's like, oh my God, I got to ace step 2. But back in the day when it was numerical for step 1, when I sat in 2012, I thought that step 1 material was like better. I hated step 2 prep. I was so bored with that stuff. Next best step in management and like fluids and all, it was just stupid. I didn't like it. Costas, what are your thoughts on recalls? I mean, everyone already knows about the whole like controversy, the cheating thing that went on, and so you can't advocate for that. And I think that it's karmic, right? So I mean, I don't think that's a good practice. You gotta just put in the work and study hard. Because if you try to take shortcuts, I mean, that karmic bill will be paid at some point. Zayad, how many questions do I need to get right from the 280? From the 280 to pass step 1? What are you talking about? You're talking about the 200. Okay, the 280 questions on the step 1. When you say 280, I think you're talking about like 2CK scores right now. Well, I said 65%. That's what you need. Boda Vula, really love your videos. I listen to them while driving to college almost every day. Amrith Melman, what's your favorite Kanye album? There was a funny clip. There was a funny short on Instagram with like it was like a deep fake video of a conversation. I think I posted it to my IG story. I did that. It was like between Elon Musk and Kanye. That was like a funny like deep fake conversation that they had. Zayad, how many questions? I just fucking read that. Zachariah, Dr. Mike, you remembered me. Remember typing to you on YouTube lives about failing step 1. I passed it 1 year ago. That guidance would be possible. That's great, Zachariah. Ibnuv, what if I did the URL assessment exam and I got a really bad score? Well, that's not good, huh? So I don't, they are actually accurate. I've said you don't have to do the UWorld self-assessments because we've got so many NBME exams to go by. So, but if you do a UWorld self-assessment, they are pretty accurate. So I would say, okay, annoyingly, we have a data point now where you did poorly on a UWSA, a UWorld self-assessment. And now we have to think about, are we going to have to take a step back and do remediation? What are we going to do? So I'd have to sit down with you and like chat about that. But we'd want you to sit other NBME exams to really see where you're at. Mohammed Fathi, does the new NBME that will be published mean the exam would contain new information on? Probably not. Probably not. Because the NBMEs have repeated questions for decades, literally. Okay? Like the anatomy questions on my real step 1 back in 2012 are the ones that show up on offline NBME 24. There's a question, I think, on NBME 26 or 27. There's a graph with like mannitol and ADH. That same question shows up on offline NBME 6. I sat NBME 6 back in like 2012. Okay, online. I sat that. And that question is currently online. So the questions are just recycled. People get fanatical about like offline versus online. It's like the questions are the same. Where you get offline NBMEs, just use the internet. MA, if someone doesn't know anything at all, starting from zero, you already asked that. If you have 1 month, Muad, if you have 1 month left before step 1, should I just be focusing on NBMEs? The answer is basically yes. The final month should be all NBMEs 20 through 31 and free 120. Murshid, I have 2 weeks for my exam. You finish NBMEs 20 through 31, 75 average in them. What should I do in those 2 weeks? This is my retake, second attempt. 75 is high, but I'm should you doing those 2? It's your second attempt. I'm assuming 75 average in them because you've already those are your second attempts on those NBMEs. You can do prior to Form 20. I would want more accurate scores, like first time passes of NBMEs to like be confident that's where you're really at, 65 plus. So I would have you do before like 19 NBMEs 19 and earlier to see where you're at. Hamza just stuck in my NBME for step 2. MA, you asked the same question over. Hi, Doc. Umair. Hi, Doc. If someone has strong basic science knowledge, can you do more than 80 plus questions a year? I don't recommend it. So if you finish 80, I said 40, 80 questions per day in Qbank. If you finish 80 and you have more time, do other stuff. Do my PDF reading, the reading of my PDFs, do YouTube MCQ playlists that I have. I don't advocate for doing more than 80 questions per day, almost always. Shami, do you recommend Pixarize for immunology, biochem, neuroanatomy? I do not. Anna Pang, I have a high CBSE, high pass CBSE. Shami, do we have to do all NBME or some specific only for step 1? You're gonna do all the NBMEs 20 to 31 and free 120. 20 to 24, free 120, 25 to 31. I'm only gonna do a half an hour here. Can I pass step 1 if I don't like doing ethics, biostats? You don't have to study ethics. I have a high yield ethics, and I have high yield ethics PDF, communication/ethics, but you don't have to study ethics because like the questions, the scenarios you get on the real step 1 and step 2 for that matter are going to be EQ scenarios that you can't prepare for. That's pretty much going to be the situation, is like you'll study ethics, but then it's just novel scenarios you can't prepare for. There's an EQ component. But you got to know biostats. There's no excuse for missing easy question. You got to know like sensitivity, specificity, PPV, NPV, the basics. You don't have to freak out about like p-values and like weird questions, okay? But just like you got to know the basics. Because I'm only doing a half an hour, I'm going to start cherry picking some questions. Chat just moved me down. Should I do pathomicro from your... you asked the same question 50 times. Pathomicro from your PDFs instead of FA. High yield path PDF I've talked about a million times. You're going to do that. You got to do high yield path PDF that I've made. And micro, I've got micro modules that are free. I've got cards that are paid, but I have free micro modules on my website. You can do those. Is your world step 2 CK 3 notes a PDF and Telegram named by you? That's an old fucking PDF. I wouldn't do that. That's an old. There's a PDF I made back in like 2014 when I was studying for 2CK of like UWorld notes. And I originally had it on my website and then I took it down or like made the page private. And some people like got a hold of this PDF and think it's like, oh my God, like it's like a treasure, like they uncovered gold, like this mystery PDF that like, you know, is so difficult to find. And it's like, well, there's a fucking reason it's difficult to find. It's like, why do you want to study 2014 outdated UWorld notes? Like my new PDF, the PDFs I have right now are based on the NBME exams, what's actually assessed. The NBME is the real USMLE, not fucking UWorld. So you're talking like my PDFs now are not only are they updated, but they're based on the NBME, which is the real exam, not an outdated Qbank based PDF, which is nonsense. Yeah, I said I'm only gonna do a half an hour. We just scroll more toward the bottom. Is step 2 UWorld more challenging than the real deal? Yeah, I would say UWorld is harder than the real deal because Qbank has a lot of nitpicky questions and the NBMEs aren't so much like that. You can get left field questions in NBME, but I'd say Qbank is harder than the real USMLE. There's a lot of garbage in Qbank. What's the difference between your paid and your free PDFs? I don't have paid PDFs. They're all free. I've got paid micro. I've got like cards. I've got Anki cards that are paid, but the PDFs are free. Mike F. I'm far out from my exam. You're just spamming the question now. Don't spam. Don't spam. I know you want to be seen, and you're like, oh well, I was effective, but don't spam. I'm far out from my exam. Do you suggest doing both Qbanks? Yeah, if you're far out, you can do like more than one question bank. But if you're like, 4 months out, one Qbank. Reef asks if my cards are good. Of course they're fucking good. I made them. I mean, what kind of question is that? Yeah, right. A lot of questions, I did these live streams like last year and I could do like 3 hour. I did like 3-4 hour live streams last year and I did them in the afternoon USA time. Right now it's night in the USA. So we get fewer of you guys during this time, but yeah, I'll probably do. I mean, I see you guys are asking questions here. Do this for 4 hours, but if I do more live streams, I will post to the Telegram group like I did this time. Okay, and then we can just improvise, go from there. Happy Feet asks, "What's your favorite anime?" It's going to be JoJo anime, 4th season.